Hello, my name's Christine Dorset, and my project is developed, implemented, and evaluated a pediatric mental health resource guide for resident physicians at an urban pediatric primary care clinic. This project was a DNP student-led quality improvement project aimed to improve resident physicians' comfortability with addressing anxiety and depression with pediatric patients at an urban primary care clinic through the development, implementation, and evaluation of electronic mental health resources. As of 2016, the National Survey of Children's Health identified 46.6 million U.S. children aged 0 to 17 years old as having at least one mental health disorder, with 7.7 million of those children not receiving treatment or therapies from a healthcare professional. Additionally, suicide is a leading cause of death among youths aged 10 to 24 years old. The project occurred at an urban pediatric primary care clinic that provides care to a diverse population of patients aged 0 to 21 years old. At the clinic, 12 resident physicians conduct visits and provide care to patients during afternoon clinic hours. 6 attending physicians serve as faculty champions to oversee and advise the residents. An anonymous Likert-type survey was given to all resident physicians at the clinic, which revealed that their comfortability with addressing anxiety and depression with the current resources at the clinic were a problem, as only 2 of the 12 residents, or 16%, felt great addressing these diagnoses with the current resources. Qualitative interviews with half the residents also supported the survey findings. There were no standardized resources relating to anxiety or depression that were used universally by the residents at the clinic. The purpose of the project was to improve the resident physician's comfortability with addressing anxiety and depression with pediatric patients at the clinic through the development, implementation, and evaluation of electronic health resources. The PDSA model, the Plan, Do, Study, Act, was used to guide the project. 27 process objectives and short-term and long-term outcome objectives were developed. 2 PDSA cycles were conducted. Project methods included the development of 2 SmartPhrases, one for anxiety and one for depression, the 2 most common mental health diagnoses noted at the clinic. The content of the 2 SmartPhrases is included in the QR codes in the methods section of this presentation. Additionally, a post-intervention survey and education materials were developed. The created SmartPhrases were incorporated into the residents' workflow via Epic to promote standardization. Education materials on the developed SmartPhrases were given to all clinic providers in both PDSA cycles. Bi-weekly data collection on the use of the developed tools occurred during implementation in both PDSA cycles. The results of the project. 100% of the clinic providers received education materials on the developed SmartPhrases in PDSA cycle 1 and 2. Bi-weekly data collection on the frequency of use of the created SmartPhrases occurred throughout the implementation stages of PDSA cycle 1 and 2. Despite challenges that occurred during both PDSA cycles, of the 27 process objectives, 13 were met, compared with 14 were unmet. After 2 PDSA cycles, the SmartPhrases were used 5 times. Post-intervention surveys were not obtained due to the implementation of PDSA cycle 2 ending prematurely. In conclusion, providing standardized resources that are incorporated into already existing workflows was trialed to help improve resident physicians' comfortability with addressing mental health. The developed SmartPhrases aim to provide evidence-based, standardized, and relevant resources to support the residents when helping patients and families manage or learn about their anxiety or depression. Interdisciplinary collaboration was effective in identifying what would be pertinent to clinical practice to include in the intervention SmartPhrases. Utilizing the PDSA model allowed for multiple iterations of the project to occur despite challenges. Numerous internal and external factors impacted the results of this project. An evaluation of the project would allow for further understanding of incorporating a new research-based electronic tool into residents' workflow to improve their comfortability with mental health diagnoses at a pediatric primary care clinic.